Hello everyone. Today we'll be talking about the management of burns, basically focusing on the first aid management of burns. So when we talk about burns, a burn refers to an injury to the skin or other organic tissue primarily caused by heat or due to radiation, radioactivity, electricity, friction, or contact with chemicals. So I know the most common type of burn we refer to is the one caused by heat. However, you just need to keep in mind that burns can also be caused by radiation, radioactivity, electricity, friction, or contact with chemicals. So you need to know that there is a classification of burns, okay, as first degree, second degree, third degree, or even fourth degree. So when we talk about first degree burns, how would you know it's a first degree burn? They're going to be painful, they do not blister, and they do not scar, okay? Then the second degree burns, in which we've got superficial, partial, and deep partial, okay? So superficial partial, the partial thickness burns, they do not require surgery, but they may scar and they may be more painful. Then deep partial thickness burns require surgery and for most scars and they are less painful. So how would you recognize them? They usually blister and they weep, and with increasing depth there is increased risk of infection. With increasing depth there is also increased risk of scarring. Then when we talk about third degree burns, which we call full thickness burns, they usually dry. They are insensitive to light touch and pinprick. Small areas will heal with substantial scar or contracture, and large areas require skin grafting, and there is a very high risk of infection. Then when we talk about fourth degree, they involve muscle or bone and they lead to loss of the burnt part. So first degree burns, basically they're going to be red, there'll be non-blistered skin. Second degree burns, there'll be blisters and some thickening of the skin, as you can see on the diagram. Then third degree burns, there is widespread thickness with a white leathery appearance, as you can see on the diagram. So basic guidelines on first aid for burns is provided below. So what you should do: number 1, stop the burning process by removing clothing and irrigating the burns after you have ensured your own safety, okay? So maybe the first thing I want to say is ensure your own safety as the first thing, then you go ahead and stop the burning process, okay? 2. Extinguish the flames by allowing the patient or the person to roll on the ground, or by applying a blanket, or by using water or other fire extinguishing liquids. Use cool running water to reduce the temperature of the burn. In chemical burns, you can remove or dilute the chemical agent by irrigating with large volumes of water. Thereafter, wrap the patient in a clean cloth or sheet and transport to the nearest appropriate facility for medical care, okay? So the first thing, basically a repeat of what we just talked about, is in more detail. So 1, stop the burning process as soon as possible after ensuring your own safety. 2, remove any clothing or jewelry near the burnt area of the skin, including baby's nappies, but do not try to remove anything that's stuck to the burnt skin, okay, as that can cause more damage. Cool the burn area with cool or lukewarm running water for 20 minutes as soon as possible after the injury. What you need to take note is never use iced water, or any creams or greasy substances like butter. Keep yourself or the person warm. Use a blanket or layers of clothing, but avoid putting them on the injured area. Why are we keeping them warm? Because keeping them warm is going to prevent hypothermia. Cover the burn with a cling film. Treat the pain from a burn with paracetamol or ibuprofen, and raise the affected area if possible. This will help with reducing the swelling. What not to do? So what to do and what not to do, both are very important, okay? So what not to do is as important as what to do. So 1, do not start first aid before ensuring your own safety, such as if it's an electrical burn, you need to switch off the electrical current. Wear gloves for chemicals. Do not apply paste, oil, haldi, which we call turmeric, or raw cotton to the burn. Do not apply ice because it can deepen the injury. Avoid prolonged cooling with water because it can lead to hypothermia. Do not open blisters until topical antimicrobials can be applied, such as by a healthcare provider. Do not apply any material directly to the wound as it might become infected. And avoid application of topical medication until the patient has been placed under appropriate medical care. So when you have a burn, when would you want to go to the hospital? So if you notice there is a large burn that's bigger than the size of the affected person's hand, 2. Deep burns of any size that can cause white or charred skin. 3. If there is a burn that is affecting the face, neck, hands, feet, any joints or genitals, all chemical and electrical burns need to go to the hospital. Any other injuries that need treating, and if there's any signs of shock, which are there's cold, clammy skin, sweating, rapid shallow breathing, and weakness or dizziness. So in the above cases, you need to ensure you go to the nearest healthcare facility as soon as possible. So electrical burns, when you look at them, they may not look serious, okay? However, what you need to know is they can be very damaging, and anyone that has an electric burn should seek immediate medical attention. If the person has been injured by a low voltage source up to 220 to 240 volts, such as a domestic electrical supply, safely switch off the power supply or remove the person from the electrical source using a material that doesn't conduct electricity, such as a wooden stick or wooden chair. And do not approach a person who's connected to a high voltage source, 1000 volts or more. Then acid and chemical burns, they can be very damaging and they require immediate medical attention at an A&E department. If possible, find out what chemical caused the burn and tell the healthcare professionals. And if you're helping someone else, put on appropriate protective clothing such as gloves, and then 1. Remove any contaminated clothing on the person. If the chemical is dry, brush it off the skin and use running water to remove any traces of the chemical from the burnt area. Then sunburn, which is the most common type of burn. If you notice any signs of sunburn such as a hot, red and painful skin, move into the shade or preferably inside. Take a cool bath or shower for 10 minutes to cool down the burnt area of the skin. Apply after sun lotion to the affected area to moisturize, cool and soothe it. Avoid using greasy or oily products. If you have any pain, paracetamol or ibuprofen usually help with relieving the pain. And stay hydrated by drinking plenty of water. And watch out for signs of heat exhaustion or heat stroke, whereby the temperature inside your body rises to 37 to 40 degrees Celsius or above. So that's all about the first aid management of burn. If you like the video, please like, subscribe and comment. Thank you.